Welcome to the Silicon Slope Sandy Draper chapter town hall event. Normally, we do these in person with a large group of people here with breakfast and lunch and business connection, but this is a little bit different this time. We're doing this from YouTube Livestream studio. We have converted here at Salt Mine our largest room into a Livestream studio. And so we're excited that you're here to join us in this studio. It's a brave new world. Everyone was temperature checked when they came in. And given a mask, and we're practicing social distancing, and we're gonna have a great event. We've got Greg Summerhays here, president of South Valley Chamber, and he does such a great job. He's gonna moderate this event, and we're so glad that you joined. Feel free to ask questions in the comment section if you like, and we'll try to get to those if we have enough time, but we do certainly have a full schedule. So, Greg, will you introduce our guests and we'll kick it off?
Yeah, I want to just start off by saying thanks so much for hosting us here in this great studio. It's awesome to see what you've done with the space, and it's great to see your face. It's great to have some interaction even though we're 6 feet apart. But this is going to be our new normal. Governor Herbert yesterday announced that we'll move from a high-risk level to a moderate risk level beginning this Friday. And so we're going to start to see some return back to work, some businesses opening up again, and that's going to mean a shift and a change in how we operate it. And you alluded to the fact that today when we walked in, which gave us a good level of comfort too, that we were temperature checked and we had our masks on, and now we're practicing our social distancing here at 6 feet apart. So we're all going to get used to this new sort of way of living and way of operating, and find a way to balance out the health and safety of individuals, of our employees, of those that are shopping and recreating, as well as protecting us, but also reopening business again. At the South Valley Chamber, we work with a lot of businesses and a lot of small businesses, and this has been very difficult on a lot of them. And so it's time, and we're excited for the opportunity to look at phasing back into a work opportunity while balancing that health and safety. We have a great program today, some great speakers, and we're going to be able to talk about a lot of great technologies. So just to kind of go through a little bit of what the program's going to look like today, we're going to hear from Turing, who does thermal scanners. Like we talked about, this one that we did today was one that was held up to our forehead. These thermal scanners, you put your face up to a machine and it's going to scan it, and they have some other technologies that can scan crowds and things like that. So to talk about that technology and what that could mean for events and activities moving forward. Altera is a local Utah company here that deals with supply of PPE. As we go back, and from the governor's directive, we're going to need to be sanitizing workstations, we're going to need to be wearing masks, and is there enough of that to go around? So we're going to have a discussion about that. Mayor Troy Walker with Draper City is going to join us, and he's going to talk about an antibody pilot program that has been going on in Draper and in the south end of the valley, and what that could mean for identifying those that have already had the disease, those that aren't susceptible to it, and how that helps us in getting back to a new normal. We also have Senator Kirk Collimore here with us, and he's going to talk about a bill that was recently passed in the Utah legislature during their virtual session about protecting employers as we do phase back into back to work, and how we can protect employers from exposure. And then we're going to finish off with Dr. Michael Good, CEO of University of Utah Health, and he's going to talk about how Utah's doing and what this new future looks like for us. So with that, do we have our friends from Turing on?
We don't have our friends from Turing on yet, but we do have Altera here in studio. Why don't we shift to Altera as our friends from Turing hop on?
Let's do that. So we're going to invite Matt to join us here on the stage, and Matt's going to tell us a little bit more about Altera, but then also talk about the supply chain. So Matt, join us up here. There's been a lot of discussion of is there enough PPE equipment to go around for our frontline healthcare workers, and I feel like maybe we've answered that question. We were able to provide that, but now as we talk about people going back to work and requirements of having to wear masks and PPE equipment, are we going to have enough to go around to protect people? So Matt, thanks for joining us.
My pleasure, Greg. Thank you for the invitation. So that's actually a very good question. That's one that's on the forefront of pretty much everyone that we talk to is, how do you manage consistent supply, quality supply in an environment with unprecedented demand, where the supply chain is primarily pretty much broken. I think we've found out through this process that a lot of the stresses we didn't know existed have kind of come to the forefront in an accelerated environment. I think it's a good thing that it's happening all at once versus down the line, so we can address those issues right up front. When we started this whole venture within the COVID-19, we were already working on sourcing and supplying PPE products and investigating what we feel are revolution game-changing products. But then COVID-19 hit, and then pretty much even with our existing supply chains, demand started moving out 6, 10 weeks, and we can't get products, supply, and sourcing materials. And how do you manage that and ensuring that you have quality products where previously you might be paying $9 for a polymer that makes a product, and now you're paying $100 per kilogram for the same product and the same product quality. So one thing that we're doing to try to address that is shorten supply chains, try to source as many different products that we can locally, with at least on our shores. We've been running through manufacturing facilities just trying to, whether it's Chicago or whether it's Wisconsin, but we're actually now trying to take that a step further by, vertically integrating and sourcing our own manufacturing facilities here locally within the state of Utah. And you're seeing unprecedented demand. We've seen reports of, even on the hand sanitizer business, a CAGR of over 62%. So how do you manage that with the, with the new workplace environment of making sure that everybody is, cleansing their hands, making sure you have a quality product? Because one of the concerns we have is there's a lot of people that with the I guess the lowering the bar of government regulations on what type of products can be made and sourced, and how do you ensure that you're getting the quality product you were pre to those levels before COVID-19? So that's been a challenge. It's something we're very mindful of here, and how do we address? But we think that we, through pre-existing relationships, contacts, and making sure that you've gone through the appropriate cycles to de-risk that process, we will be able to meet the demand. But it will be an unprecedented level as we focus primarily on our first responders and making sure that the healthcare systems are appropriately managed and inventorized and prioritized, moving to the workplace, even as we've had to provide significant levels of PPE for local businesses that are previously were already planning. Even in the beginning, they're planning, okay, we know we're shut down, we're going to have to open up, but you have to prioritize the healthcare workers first and then moving to them second. So.
And what would you say to people that have that exact concern as we do now start to sort of phase and open up some businesses? Is there going to be enough to take care of those workers and those businesses without sacrificing the PPE equipment for our frontline healthcare workers?
Well, I think the challenge is there is enough. I think if you temper expectations, if people are stockpiling and trying to get everything all at once, just like we saw with toilet paper at Costco, I think there's going to be some challenges in meeting that demand, because we are seeing, as the supply chains are starting to normalize and stabilize for these hospitals, we're seeing that they're stocked for a period of time, but then they're going to have to do their reorders. And so the concern is going to be is, how do you prioritize those reorders, because their demand is more than tripled within their current patient populations, and then how do you prioritize that in the workforce? But I think if you rationalize and you kind of work through what you actually do need, then I think that there will be the ability to supply that long term.
What would be a reasonable amount to stockpile? I don't know if there's an exact number, or is it based on your employee count or what, but is there a way for employers to judge and say, I'm going to be okay and I'm going to be able to protect my workers if I have this much supply?
That's a good question. I think one of the questions is going to be what's appropriate for the workplace versus in the healthcare vertical, because there are different levels of what the expectation is. Face masks, for instance, they measure something called BFE, bacterial filtration efficiency. And in a healthcare environment where the exposure is much higher, usually they want a higher count. In the workplace setting, the cotton face masks often is just perfectly fine as long as you're protecting whatever particulates are coming out of your mouth. So I think just managing that from supply chain from there is what's appropriate, what's not. But then as far as you're dealing with your disinfecting solutions and hand sanitizers, It's going to be, we don't know what that new level, we don't know what the new normal is yet. We won't know until it opens up. So I believe it's going to be pretty substantial. But I think if we are creative in the solutions that we do provide for those settings, it'd be fine. One of the thoughts that I don't know if employers are thinking about this right now, I've talked with several that are large national employers that are thinking through this right now, but yes, you protect your healthcare workers in the healthcare setting, or sorry, in the work setting, but then what happens when they're at home?
Yeah.
Right? They go and get exposed and they might not have access to appropriate PPE. How do you manage that and de-risk that process when they're in the home? Because then they're just as exposed, they come back to the work setting, and then there could be a risk there as well. We've worked with other companies that are providing the checks and the appropriate PPE for those settings too, but that's something I think employers need to be cognizant of.
Yeah, and I think as we go through our discussion today, that's a part of the discussion is how do all of these elements play together to keep people safe and healthy. And we're going to invite some people back to work if they are healthy and safe and back into society. And we're going to ask those that aren't to self-quarantine and to protect themselves and protect others.
Exactly.
So I think that's a great point you made. What are some of the biggest takeaways? What have we learned, and how are we going to be better prepared in the future when something like this happens again?
Well, I think one of the key takeaways is I don't think we realized what our current status on the supply chain was. And I think that we were a little bit exposed on the different macroeconomic challenges and stresses that can impact the supply chain. One of those being whether it's political pressures, that's impacted it. We've had even media pressures and announcements going out in the media changes some of the supply chain on a daily basis. Raw material sourcing, costing, and supply. All those things I think we found out were extremely exposed in one certain area of the world. I think we're going to start seeing, both from a procurement standpoint, whether it's businesses and hospitals, healthcare systems are going to want to mandate procurement as much domestically and locally to make sure that we're protected. And I think just making sure that the quality and the consistency of supply chain is there. So I think that's, from my perspective, I think the key thing is people are going to be very more cognizant of where we're sourcing stuff.
Yeah. Is Utah well suited to produce this PPE equipment?
We actually believe it is. In fact, that's something that we at Altera and even with our partner VC firm, Mountain Pacific Venture Fund, we're aggressively trying to pursue options to make Utah one of the hubs for that. And we believe that we're in a great situation and position to be a hub for that.
That's great. And I think that provides people with a lot of comfort. I mean, you mentioned the debacle with the toilet paper, right? And people just feeling this fear. And now all of a sudden, as we phase back into this moderate part of the plan, people are going to get out a little bit more, and there needs to be a comfort level, and these masks and the PPE equipment is going to help provide people with some of that comfort level that they are protected and that they're protecting other people as well. So appreciate all you guys are doing and your expertise, and we'll look forward to continued conversations about the supply chain and how we can manage it and ensure that not only all of the people that are going back to work, but that we continue to protect our healthcare workers and all that they're doing to protect us. So,
absolutely. Thank you so much. My pleasure. Thank you for the opportunity.
Thanks, Matt. Appreciate it. All right. Do we have our friends with Turing on now, Dave? We're going to find out. Okay, we're going to find out if they're on there. We're grateful for all of these participants joining us today to talk about these different elements that are going to help keep us safe. But I met this company Turing maybe 2 weeks ago, and we started talking about thermal body scanners, and it's something that's really foreign to our environment, to our world. We haven't dealt with those kinds of things. We've got Rick on here. Rick, thanks for joining us today. I'm gonna throw it over to you. Tell us a little bit more about Turing. Tell us a little bit more about these thermal body scanners and why they're important and how they can help protect us in the workplace setting, when we go to events, and give us that peace of mind that we're interacting with other individuals that are healthy.
Rick will probably need to unmute his microphone. Rick, are you with us? All right, as maybe you can send Rick a quick message.
Yes.
And this might be a fantastic opportunity to maybe get Senator Cullimore to join us. So let me grab him. If you'll reach out to...
Yeah, we'll reach out to Rick and see if we can get
Rick.
him ready to go.
I think he just needs to unmute
Unmute it.
himself. Yep. And this is the new abnormal that we're talking about. Stand by for Kurt Cullimore.
But like I mentioned earlier, so I've seen a little bit about this technology, and it can scan full crowds. It can scan individuals as they walk into the building, and it'll say, yes, your temperature is below, or yes, you have a higher temperature. And then what we need to decide is, what do we do with that information? So if an individual is going into work and they do have a high temperature, this is an indicator that they're unhealthy in some way, shape, or form. Where do we send them then? Are we sending them off to get tested? Are there medical providers we can send them to? But what we want to do is really work to protect the health and safety of individuals. So I don't know, do we have Rick on now? Rick, can you hear us? We just need you to unmute yourself. We can't hear you yet. There you go. I think we're there, Rick.
Can you hear me?
Yep.
Can you hear me?
There you go. So tell us a little bit more about Turing. Tell us about these thermal body scanners. How is this something that's going to provide some good peace of mind to us as we get back to work?
Okay, great. Thank you, Greg, for letting me join today. Let me bring up my screen real quick and click on here. Just you guys are using Zoom on your end, or?
You are on the Zoom.
You're on the Zoom phone. Yes.
Okay, fantastic. Can you see my screen?
We cannot.
We cannot.
Let's see. About now.
There we go.
There you go. Yeah.
All right, great. Sorry about that. It took me a few seconds there. Thank you for letting us join today, David. And Greg, I'm sure you're out there in the audience somewhere, and I'll wear my mask for you if you want. Hey, we're based out of San Mateo, California. We're in the Chase building in downtown San Mateo. At some point in our future, we'd love to have it named the Turing Building. We're growing very rapidly. We're funded by Village Global, which is a Jeff Bezos and Bill Gates organization. But our managing partner is Ross Rubini, who is not listed on there right now for some reason. But the point is, we're not managed by Bill Gates or Jeff Bezos. It's just a fund they put together to get robotics and AI companies off the ground. If you were to Google robotics and AI, the U.S. government was in a quick battle against China and have promised $25 billion in funding. And the way they get that funding out there, outside of the top 7 AI providers in the world, is through smaller venture firms like Village Global. And we were the recipient of that. So we make robotics, and our robotics do anything from sensor-based robotics and to AI recognition, fingerprint recognition, et cetera. They're about 36 inches high, and they roam around predominantly unnoticed at night. And we were doing a pretty good business. We have to get on site to install them. So when COVID hit, that kind of died. Our servers run the back end, and we do provide a few cameras. We decided to take the thermal scanner off the top of the robot, and we made our zero contact thermal scanner, our engineers, so that we could stay afloat and continue working. And boy, did we hit something. And sometimes there's like 15 sayings: never miss the chance to take advantage of a crisis, or necessity is the mother of invention, right? But also you need a little luck. And the Wall Street Journal posted this article saying everybody's going to be scanning, temperature checks everywhere. And we got a call from Costco, which is right behind me, the lobby. And they put the first 50 in. And then we went up to Issaquah in Washington State. And this is what we wore on the plane ride. So things have changed. I'm used to wearing a suit. You can kind of see the progression. We've taken some parts from the best of both of our robotics and our AI servers, and basically our algorithm is a machine learning rendered software package that we put into our operating system. It's based on the Linux kernel, and it recognizes a human face in a split second, with or without a mask. Doesn't matter to us. we loaded millions upon millions of images of faces, not names, just faces. And we render that up through our machine learning servers, and then we put it in our operating system. As soon as you walk up to it, it says, hey, it's a human face, it's not a dog. Or if it's a dog, it says this is not a human face. But most of the time it's going to be a human face. And then within a tenth of a second, it'll scan you. And then within a second, you're done. You move on, okay? And you have the option today only to have it be audible. But keep in mind, we've just been shipping since the 20th of January. We went GA. And in another month or so, we're going to release a networking component to it. We could probably revisit it then. But it will allow you to network all the scanners up into one application that you own. It'll be secure. It'll be only your scanners. It'll have access controls. It's pretty slick, but we're going through penetration testing, which basically is hacker-proofing it, and SOC 2, which is encrypting, making sure everything's encrypted in flight and at rest. Because this is important information, and if you get a couple thousand of these things tied together in an app, it's really important information. You don't want it on a laptop, all these pictures and temperatures walking out of the building, because while it's not adding a name, it could easily be added, okay? Let me just see. I'll continue going, and then I'll come back to this video. Again, COVID came about, and what the CDC said is 100.4 temperature. Basically, right now, I'd say it's 100% you have COVID. So we needed something that was non-contact. You just walk up to it, you scan yourself, and it very quickly says yes or no. In fact, we could program it to say anything you want in English, Spanish, French, and Chinese, and a male or female voice or computer-oriented voice. Results in a second. Anytime you see a red box or any kind of a box in a thermal image or any kind of video image, that means there's some AI in the background. And if you want to talk AI, shoot me an email and I'll talk to you about it all you want. It's FCC approved, it's CE approved, and the power supply and plug is UL approved. Those are the main things that customers ask for outside of the FDA approval. We're working with lobbyists now to get the FDA approval fast track, but I can't guarantee any timing on that. It's glare resistant. We prefer indoor applications because the sunlight, direct sunlight, will cause the reading to be erroneous. So you'll see in a couple more pictures in a minute that most of our customers put it under a tent if they go outdoors or inside. Okay. The thought process behind that is if you get out of your car and it's 40 degrees outside in Anchorage, Alaska, where we ship some of these, and you walk to your office, your forehead's going to be cold. But cold's really not an issue, right? You warm up in about a minute. It's the hot. If you're in Tempe, Arizona, it's 120, your forehead will be hot. That takes about 5 to 10 minutes to cool down. So you have to have some place to acclimate. Okay? Here's the dimensions. Basically 5-6 inches wide, 10 inches tall, and depending on how you mount it, anywhere from a desktop version that's 3 feet tall to 70 inches tall on an adjustable rack, and I can share that with you. We have it now in almost every one of these environments: dentist office, hospitals, kindergartens. We're coming up on a agreement with a large daycare provider. Building lobbies are where we started. I would just place them in the lobbies and walk away and wait, put our phone number on, and the phone started ringing beyond belief. And then we hit the news, the AP press. So if you go to our website, www.turingvideo.com, right on the website is this article about how we were in Albertsons, which is a very large company out of Idaho, that they own Safeway and Bonds. And they have a distribution center in Tracy, California. We put our first 2 scanners off the assembly line there, and they had 5 entrances. They only used them on 2 entrances. They detected 5 people with fevers. They have pretty good protocols in place. They hired a third-party physician to do that. And then those folks were sent home and tested, and they all tested positive. The next day, 50 people had fever and tested positive. The next day, 300 people had fever, and OSHA shut them down. The following week, 5 people passed away. So it spreads very rapidly. And this was just one tool in their arsenal, right? A mask, temperature checks, questionnaires, the ability to immediately put them in their car, provide benefits and pay even though they're sick, and then get them to a COVID-19 test center, and then make sure they don't come back until they've had 3 consecutive days without a fever. So pretty tight protocols that if anybody wants to talk about those as well, I have a physician on staff, or you may have someone on staff, I'm sure, in the great state of Utah. But I pay somebody to advise on protocol setup, and it shouldn't take long. Okay. This is the adjustable stand. You can kind of see it, but you can't hear it right now. I apologize. I'm having some Zoom difficulties. But this one adjusts to 70 inches. This has become quickly our most favorite stand, but I've also in the works with a new version that will combine the best of both worlds. It'll adjust and it'll be stationary at the same time. So people won't go up to it and unscrew it and try and lower it. This is just a little durability video. It's a pretty solid product. It's, we're using the same kind of glass as a iPad, except for it's not touch. Very high quality glass. The next, we're advancing this every day. This is version 1. We're on version 3 already. It's only been since the 20th of January. That's both the software and the casing. So we're making an all-inclusive casing that's a little bit darker and thinner, and it's looking really good so far. This is where we mounted it on the wall, on the turnstile, and yes, it can control the turnstile. If you look down at the bottom picture there, there's turnstiles. Newer turnstiles usually have a screw hole on the top. You unscrew that, you put our adapter in there, and it attaches to the turnstile connections. And if you post a fever, it won't let you in. It won't open the turnstiles. In this picture, though, we just put it on top of the turnstile. Folks can still badge in initially, and then maybe in a week or so, you would change it to being locked out if they have a fever. But people, when they first come back, they want to feel like they're easing into it, feel like their needs are being met, their emotional needs are being met. I'm almost done. You've seen all the slides. That was the timeline of our early detection, and I can share that with anybody. And Dave, am I running out of time?
You've got about 1 minute.
Rick, tell us a little bit about cost and how quickly something like this could get implemented.
So within 30 seconds out of the box, you plug it in, and it's working. I am shipping to meet demand on a daily basis. There's no one waiting more than a week. And the price ranges, actually the exact price is $2,500 today for the scanner. And then we have 4 stands that range from $60 for a wall mount to $250 for the adjustable mount. The other 2 are $150. We have advanced replacement for years 2 and 3 if you want to pay for that up front, or you could do it in years 2 and 3. The reasoning behind that is, again, if these things fall over or get banged on, you don't want to mess with calibrating it on site. We'll ship you a new one, you ship the old one back.
Well, that's fantastic, Rick. Thank you so much for sharing all of that. And if anybody needs to follow up with you, they can go to Touring Video. And so, again, thanks. Stay safe and appreciate what you're doing to move the ball forward with technology.
Yeah, and this
Thank
is
you,
one
Dave.
of those.
Thank you for inviting us. My pleasure.
Oh, sorry, Rick. This is one of those technologies I think that can help in lots of different areas. This could be for a small employer, for a larger employer, the different models that they have on there. But as the governor has released sort of the recommendations, symptom checking is one of those. And so we need to have some technologies that are going to help us to be able to check those symptoms and make sure that we're admitting people that are healthy into our office buildings and our places of business. So thanks for joining us, Rick, for all you guys are doing, for the technologies that you've developed in this new world we live in. I never imagined a world where this is sort of where we'd be at. But this is seems very inintrusive product to be able to temperature check people and get them into the building. So thanks, Rick.
Thank you for your time and for allowing Turn Video to be on the South Valley Chamber of Commerce meeting. Really appreciate it.
Yeah, thank you. All right, we are going to invite Mayor Walker to join us up here now on the stand. Draper City has been doing something interesting. Earlier this month, they conducted a pilot COVID-19 screening, And we're going to invite Mayor Walker to join us to tell us about what was the goal of that screening and the purpose of it, and how does he see something like that helping us to be able to identify those that have been infected and maybe those that are sort of immune to COVID-19. So thanks for joining us, Mayor Walker.
Thank you for having me. If I have to wear this thing around, I'm going to stay in my house even more than I have.
It's hard to get used to, isn't it?
Yes.
So tell us a little bit about the pilot program, what you guys did, what was the
Well,
purpose and the goal of it?
A couple weeks ago, I've been working on it for probably a month. I started, learning about the antibodies, reading about them on the news, and the concept of, when you get through a virus, you get an antibody. It's a common thing for the flu virus. My brother's a physician, so we've spent a lot of time talking together about, what that means and scientifically. And so I started thinking, and I have to say, first of all, my city council, they're amazing. They told me about a month and a half ago, we want you to do something. If you can figure out something to do, we'll appropriate money for you. And they've appropriated a couple $100,000 to figure out a way to get us back to work. And so with that in my pocket, my council members 100% in support, and all of them feeling for our businesses and our community and everywhere else. I started kind of working on it. So we found a company, Rapid Response Solutions, that does antibody testing. It's a finger prick blood test. It's the same company, same manufacturer that Governor Cuomo is using in New York. And I know the knock on the antibody tests is no one knows for sure if none of them are FDA, certified, but this one and ones like the ones in New York are FDA approved for trial use. And so that's what this one is. So we set up a screening with these guys. It was really slick. They set up a parking lot at the aquarium, and we had 112 tests total. I had 4 people that I knew had recovered from COVID-19 in the line. So you pulled up in your car. They have an app. You go on. You answer some questions. By the time you're done with the questions on the app, you pull up, put your hand out the window. A nurse pricked your finger, took the blood. You pulled up and waited 15 minutes, and they gave you a printout. So they found all of the people in the line that they should have found with antibodies. We didn't find anyone else that had antibodies. So all of our public safety, most of our police department, all of our firefighters, and the members of the community that I kind of invited to run through this test. They did 114 screenings in about 70 minutes, so it was really awesome. It was fast. And so with those results, what I want to do is I want to roll it out, and my idea was go to all of our big employers and offer them an opportunity to test their employees. So the tests run about $48 per test, all in cost. But in addition to this antibody test, the blood prick, finger prick test, there's another Draper company, Superior Solutions, that does a saliva test. It's only an up or a down, a positive or negative for COVID-19, but it's saliva-based DNA analysis is how they determine if you have the COVID-19 virus. And so we've done a little test with those. We've got about 250 down at the lab right now getting validated and tested of several cities' public safety, Riverton, Draper, Lehigh, and our public safety again. So I'm going to hopefully have the results of those saliva tests today. And so what our plan is, we're going to buy some blood tests. I've got 4 cities, 3 to 4 cities, depending on, I've got a little coalition of southern cities, Riverton, Harriman, Bluffdale, Lehigh, Vineyard. Not sure if all of them are, today we're going to decide how many to buy, but I think we're looking at buying like 5,000 of them between the cities, and we're going to set up opportunities for big employers or small employers, whoever wants to test their employees. So the test is $48 for the blood prick. We're going to filter in the saliva test as backup. We're going to do 5% random. 5% of the people tested will get a saliva test. Anyone that gets a positive antibody test is going to get a saliva test as well to see, if they're active with COVID-19. So, I'm a lawyer, not a scientist, but I think as we've kind of looked at a way to sort of get some good data and start us moving forward, that's what we're looking at doing. When you add the saliva tests in, it raises the overall cost to about $50 per test.
Yeah.
So our plan is to tell employers, we'll test anybody you want. It's $50. We're not doing it as a city, but we're facilitating getting the tests here and getting them going. But the company will come out to the parking lot of the company and do the test right there. Really, really awesome.
Well, and we appreciate your leadership on this. I know that when we presented it to our board of directors, we had several companies in there that were very interested in doing this for their employees. Now, could individuals participate in this as well?
Yeah, I mean, like I say, if anybody that wants to pay the fee, I mean, if we're not going to subsidize them, we're going to just facilitate it. I think we could buy. The hard part is to spend $50 a test and buy 10,000 of it at times a lot of money. We want to see what the interest is and see how it goes. And look, the politics of it is this. I mean, there's all this different concept about how we're going to get back to work, how we're going to do it safely. I think these antibody tests have promise. It's the same one Governor Cuomo is using in New York. And I have to say, as I've watched the leadership of Governor Cuomo, I've been impressed with. He's willing to try stuff. He's willing to do what it takes to get his city back to work, and it's impressive. And I'm just kind of trying to follow some example there. And like I said, my council has been really anxious to do something. We understand. Look, the reality is cities and the state and everybody, we live on sales tax. And the concept of the sales tax going down is a fact we will feel, and we will feel it immediately. Everyone's going to feel it, from the schools to there isn't a single person, a government entity in this state that is not going to feel this pain. Income tax, all of it is going to go down if we can't get back to work. Now, I do want to say too, I appreciate the good work of our county mayor, Jenny Wilson, and the governor's office. It's our first pandemic. It's everybody's first one, you know. And there's no pandemic 101 school.
Sure.
So and I know people, we criticize each other sometimes privately, and we might, say, why'd you do that? But I want to say to all my fellow political leaders, my hat's off to them. I think they've all done a good job. I do think there's room for us to innovate as local communities and do some of those things. I think what we did at the beginning of this, locking things down and trying to protect ourselves, was spot on. It was what we had to do. I'm 100% glad we did it. I do think we need to open up, and it needs to be safe. And my conversations with Mayor Wilson have always been, we need to open up, and Jenny's always been for it. It's how do we do it safely, because no one wants to get sick, no one wants to lose a loved one. The hard thing for me about this virus is I know two people that were really sick from it. Mm-hmm. My good friend Ben McAdams and a 23-year-old neighbor of mine, female in good health, who was in the hospital for a couple of days. So it's hard not to realize the reality. But I think Utah's done a good job in dealing with this in the way we've tried to approach it from a business perspective and a government perspective. I'm looking forward to just being a way to help innovate. And I hope our data that we collect, we can integrate into the state system, and we can just all get good data and figure out, how we can be safe and open up, get back to work.
Yeah, well, we couldn't agree with you more. It was important for us to shut down and contain the virus, and now we really need to move into that next phase of how do we slowly reopen, how do we do it in a safe and healthy way, and I think that this testing is a great pilot program and a great example of looking at some innovative ways to be able to do that.
My fellow mayors, Mayor Staggs from Riverton, Mayor Johnson from Lehigh, they've been right there with me in it. They've been they're like, yeah, we want to join, we want to get after it. Lehigh and Draper and Riverton, we all touch each other, and we're certainly all interacting. Our citizens are going back and forth. But I'm excited with the coalition of mayors I have they're all like-minded in the goal of opening safely and finding a way to do it. And so we're going to give this a go and see how it goes. And if your business wants to be part of it, I'm happy to do it. So just get a hold of my office and we'll integrate you in.
Perfect. Thanks, Mayor Walker, for joining us. Appreciate all you do.
All right.
We're going to move next to Senator Kirk Collimore. As we discussed a little bit earlier, as we do start to reopen, employers have a lot of anxiety, and they're worried about, as we do open up businesses, what liability do they have if someone's infected while at work? And so Senator Collimore is going to join us to be able to talk a little bit about what happened at the last special virtual session and the bill that he sponsored, which was Senate Bill 3007. So Senator Collimore, as you come up here, tell us a little bit more about SB 3007, what's its purpose, and how's it going to better protect employers during this time?
All right, well, thank you for having me. SB 3007 came about because as an attorney and as a state senator, I get a lot of input from businesses. And a lot of them were concerned about how do they effectively reopen. Everybody is concerned about the health of their employees, the health of their patrons and customers. But there was a legitimate concern and scare about, well, I don't know that despite all my best efforts that I can do everything to prevent anybody from ever getting coronavirus in my place of business. And maybe more importantly, I don't know that I can ever do enough to prevent somebody from claiming that they got coronavirus at my place of business. And so as I heard a lot of these concerns, and then I actually saw in another state that Walmart was in fact sued for wrongful death related to an employee who contracted coronavirus. I heard a couple of attorneys threaten that, hey, if X, Y, and Z isn't done, then you could be sued. And I thought, you know what, this is something that the state should probably address, because how can we ever effectively reconstitute our society and reopen business without businesses having some assurance that they are not going to come under claims that may or may not have legal merit, you know, while they are trying their best to give comfort and assurances to their employees and their customers that they're doing what they can to help and to be a part of this pandemic. So it came about that we said, well, let's talk about some immunity from these types of claims. And you know, that's a scary topic for a lot of people, because we don't like to just generally provide immunity, because it undermines a duty of care that businesses may feel to their patrons. But this is different, obviously. This is unique. We've never had a situation where government has shut down people where government has shut down industries and business at large. You know, individual businesses maybe, but everybody, because of the general pandemic out there, this has never happened. And so I think because of the uniqueness of this situation, it called for a unique solution to help overcome this concern. A lot of the pushback that I've heard about this is one, that this could undermine the duty of care that businesses feel to customers and to employees. And one, I just don't buy that. I'm not convinced by that argument, Greg. I think that, you know, enough people are scared about this pandemic that if businesses don't do what they can to make people feel comfortable, then people aren't going to return. Yeah. And so I think the market will work itself out that way, that businesses will take the appropriate precautions and appropriate measures to ensure that they're managing a safe business. And so I'm not convinced by that. And then the other concern has just been general tort reform. You know, if we provide immunity here, is this going to get expanded? And again, I wasn't convinced by that argument, because we are in a unique situation. So let's tailor this bill unique to this situation again.
Yeah. Well, and I know in the beginning too, I think that there was a lot of employers who just didn't quite know how to handle it. And so I think maybe some employers were a little slow in their response, which made employees really nervous. But I feel like the employers really caught up to this pretty quickly, and were providing the right kinds of safeguards for employees. And then now, as we've sort of been on a break, and now as we get back to it, they want their employees to be safe and healthy. You know what I mean? So they're going to do the things that they have to do to be able to protect them. But this is another layer of protection for them from the liability side of things. And we haven't seen any lawsuits come in the state of Utah, correct?
We haven't. And it's important to know, I mean, one question is, well, potentially anybody could have been sued last year by getting the flu at a place of business, but we haven't seen lawsuits like that either. But this is different because as we reopen, there's going to be a whole bunch of either required or suggested guidelines of you should do this and you should do that to ensure that your employees are safe and that patrons are safe. And so the concern is, by putting these standards out there, could an opportunistic attorney or an opportunistic client come in and say, well, you didn't do this or you didn't do that, or, you know, there's one little jot or tittle of the regulation that you didn't do, therefore you're per se liable. And that's not what we want to do. That doesn't encourage business to open up. Yeah. And so the thought was, with this law, let's just get rid of that. And the reality is, with these types of claims, there's a lot of legal elements that you have to meet to prevail. And I think it would be very difficult to do that anyways. But as business owners know, it's not necessarily the legal merits of a claim, it's just the threat of the claim. If somebody sues you, you incur attorney's fees or insurance costs or whatever the case might be. And that seemed really unfair in this type of environment where businesses are going to go above and beyond to try to ensure the protections that are there for their customers.
Yeah. Well, we appreciate you being proactive in this and looking ahead as we do reopen to provide these protections to the employers in the state of Utah. I think that it provides them with that level of comfort that they need.
Good. That was the hope.
Yeah. Well, thanks, Senator Colmore, for all you do. We appreciate it. And as we have additional questions come up about this, we'll reach out to you to get answers to those.
Sounds good. Thanks for having me, Greg.
Thank you. All right, we're going to move to our final presenter for today is Dr. Good. As was discussed earlier, this is our first go-round at a pandemic, right? And how are we responding and how are we doing? And Dr. Good has been instrumental, and we're excited to have a medical perspective on how Utah is doing and how they've reacted to this and what the future might look like. Is he jumping on right now?
We're admitting Dr. Good right now, yes. Dr. Good, we're going to unmute you.
Good morning.
Good morning. Thanks for joining us, Dr. Good. We're here at the Silicon Slopes Sandy Draper Town Hall. We know that you are extremely busy, so thank you for taking time out of your schedule to meet with us. And just so grateful, really, for your leadership. In the very beginning, on one of the initial Silicon Slopes calls, you spoke about what our world looks like, post-COVID or in the process of COVID, and you mused at the time about similarities to the post 9/11 world. So could you just kind of tell us what your thoughts about what that world should look like as businesses are looking to reopen over the next phase?
Well, thank you, and thank you for all you and your community are doing. So proud to be part of Utah, and long before I got interested in medicine, spent a lot of time as a computer scientist. So particularly fond of Silicon Slopes and all you and your companies are doing. This is a new virus. It didn't exist in our world just 3 or 4 months ago. And so we're having to learn to live with COVID. And certainly until we get a vaccine or treatments, particularly perhaps a pharmaceutical or other form of treatments that are highly reliable in treating this disease, the disease caused by this virus, we're having to modify our behaviors so that this is a highly infectious virus and it can move through communities very quickly. And we've certainly seen first in other countries, particularly places like Italy, and more recently in cities like New York and Detroit. I have family members in the health profession in Detroit. And when a disease runs through a community, when so many individuals are infected at once, they overwhelm the health system, and it's not good for anyone. So the things that we're doing, the things we've done so successful so far here in Utah, have indeed slowed the spread of the virus. When it started, each person was on average infecting 3 others. We brought that down. It's very close to 1. It's currently running about 1.2, 1.3. And so under this framework, I think the comments that you are referring to, before 9/11, we boarded airplanes and traveled with one set of protocols. And since 9/11, those protocols all changed. We're all familiar with check-in at the airport. Our luggage is checked. We're scanned, so that we don't have explosives and repeats of 9/11 in our country. And I think for the time being, that I think our activities are going to have to be modulated so that this virus doesn't run unchecked through our communities. So there's all the different basics: hand sanitizer and washing, the physical distancing, meticulous surface disinfection, and so on. But in this initial phase where we've had everybody staying at home, we do need to begin to get segments of our economy back to work. The economic and fiscal damage caused by this virus is real and palpable. We're certainly feeling it here at the university and in the health system. So broadly, we have red conditions: stay at home, only essential businesses are open. And on the other end, we have green, where all businesses are open, there's large groups, no travel restrictions. So the real trick right now is finding out what orange and yellow look like. And I saw today the governor is leading us into an orange state. We're certainly preparing for that at the university. And what that means, kind of my overall characterization of orange, is that if you can continue to work from home, we should try to leave home infrequently. But if the nature of your business or your work is such that you cannot effectively or meaningfully have your business, then you do so, but try to maintain 6 feet of distance, and when you can't, wear face masks. I'll give you an example. I was just on a meeting this morning, and a big part of the university is our research mission, and many of our research laboratories are currently closed. So we are preparing on Friday to, again, under this context of try to maintain physical distance, wear face masks, but we need to get back to doing some of our important research. Some of it COVID related, some of it not. But so I would encourage businesses, again, just to repeat, if you can continue to work remotely, those businesses should do so. If your business cannot function in a remote or a distance fashion, then figure out ways that best you can. We keep the distance. Remember, the distance is important because the virus spreads from one person to another through respiratory secretions. And so the thought is, even the Olympic sneezers apparently can't get much farther than 6 feet. And so that's why we try to stay apart. The masks are to slow down the movement of secretions from one person to the next. And don't forget the surface disinfection. This virus can live on surfaces for a while. So if I sneeze on a surface, or a telephone, something like that, and somebody comes along, certainly in a few hours, in some cases maybe the next day, and grab that phone, grab that surface, the virus could move that way. So I'd be happy to entertain questions. I tried to cover a lot real quickly there, but I'd be more interested in hearing what's on your mind or your questions for me.
Well, Dr. Good, thank you so much. That is very helpful. Tell us about what you're seeing at the University of Utah. Would you describe where we are right now as a plateau in infection, in death rate, and all of the metrics that you're measuring? Are we currently in a plateau phase, and how would you characterize that?
Yeah, we're following both the numbers that we currently know, but a couple that we're actually trying to get our arms around. The good news is we've had low numbers here in Utah so far, and that's because we're individuals and specific people. That's very good. It also means the numbers bounce around. We go a few days with a low number of new cases, and we start to think that infection curve has turned the corner. And then this particular weekend, we saw another pretty good cluster of cases and individuals who had COVID, and particularly in our admissions at University of Utah Hospital. In the last couple days, that's come down a bit. So we're trying to better understand, and the governor's commission, just yesterday, we were working on this, what we call leading indicators, intermediate indicators, and lagging indicators. The hospitalizations are a lagging indicator. By the time someone who has COVID gets sick enough to be in the hospital, they've typically had the disease for a week or more. That's important because one of the reasons we're doing all these things, as I mentioned a minute ago, is to avoid having the situation where we can't take care of. There are so many patients with COVID, we can't take care of it. But if we wait until there's a run on the hospital, if you will, we're behind, we're too late. The case count is one commonly followed, and that we watch that daily as well. But what we're trying to get out in front of is the number of people who have flu-like illnesses. We used to track that pretty well in our community, but with our health system so disrupted, we don't have the usual measures. The state measures the percentage of people going to see the doctor for a flu-like illness. And we kind of lost that tracking. For example, all of the people who are getting assessed and their testing done in the drive-in or drive-through mobile testing sites are not getting collected in that state database. So the short answer is we need to follow several metrics. As I said before, we do know we've slowed this down from spreading 1 to 3, spreading from 1 to 1.2 or 1.3. We'd really like that to be at 1, but we're pretty close. And so I am supportive of the transition from red to orange. As I said, we have to learn how to live with COVID, and how we make this transition is going to be really important. We'll be watching all those parameters to make sure the virus doesn't take off on us.
Well, that's helpful and encouraging to hear really from the medical community's perspective and really your personal perspective about how businesses can responsibly phase in some type of relaunch for those that are required. And certainly here in this studio, even we're practicing the mask, social distancing, everybody's temperature checked when they come in. People will have to adjust to that new normal, feeling that maybe it's a little intrusive. And so if there's one, maybe not, because you've kind of outlined, we understand all of those individual factors, but is there a philosophy of approach that you could share with us maybe? Because I think most people that have employees want to put the safety and health of their employees and their families first. And that also includes their economic long-term viability. So I think most people, you're in a position where you're managing many thousands of employees. Can you help us think through that about how do businesses maybe even love your neighbor is a way to think about this. How do we do that? How do we apply that in the business community? And how can individuals who may not understand the need to sustain long-term viability of employees, can you just speak to that a little bit? Is there maybe a nugget of thought that you've learned even during this crisis as you manage thousands of people there at the University of Utah?
I think it's a great question, and some of it we know, and some of it we'll learn in the coming weeks, and that's why these forums of communication are so important, so that we can share best practices. We did implement temperature screening of everyone entering the health system, including our own employees. Temperature monitoring isn't perfect, but it does help us if someone's ill, particularly with flu-like illnesses. We can't have them in the workplace. I've probably in the past, you felt a little bit like you had a bad cold or whatever, and you took some over-the-counter medication. You kind of powered through it to get through your day. We can't do that with COVID. We have to make sure people understand that when they're sick, if they do indeed love their coworkers, maybe even if they don't, when you're sick, you got to stay at home. And so we're using temperature checks at our place as well. We are working hard on protocols that can use the two forms of testing that we have. So earlier this week, we started doing time-sensitive outpatient elective surgery, but new to our practice, all those patients undergo testing to make sure they don't have COVID. It may be in the first day or two and asymptomatic, and there's evolving or emerging literature that patients who undergo a surgery while they're having a COVID, an episode of COVID, have very poor outcomes. So we're testing everybody with the nasal swab before they have their surgery. We're also, we've begun antibody testing. The antibody, remember, is for folks that have had COVID. Interestingly, like a report came out of Santa Clara, California, most communities so far in our early measurements here, I caution early measurements, are only about 3 to 4% of, in this case, our own health workers at the university, those that have been taking care of the COVID patients, only about 3 to 4% appear to have antibodies. On the one hand, that's good. That means our personal protective equipment and our protocols that we've been using to take care of COVID patients have not resulted in large numbers of healthcare workers. On the other hand, that means our community's, if you will, immunity or presumed immunity is not there yet. The highest numbers I've seen are in New York, where different samplings have shown about 15%, 18% of the community having the antibodies. So I don't have all the answers today, but there may be a role for either the nasal swab testing or the antibody testing as we try to navigate, particularly from orange to yellow and yellow to green. Testing is going to be, has been, and will remain a critical part of our strategies.
Well, Dr. Good, thank you. That's helpful. And just before you came on, we had Mayor Troy Walker of Draper, who is instituting through some of the Draper businesses the opportunity for the businesses themselves then to test for the antibodies. And so as a business community, we want to partner with the medical community as closely as possible to heal Utah and our nation. So thank you for all that you do, and thank you for informing our businesses today.
Thank you. Thanks for all you do, and look forward to staying in touch as we all work together to make Utah the example of the place that best addressed responding to coronavirus. Thank you all.
Thank you, Dr. Good. Well, that was very helpful, and it was helpful to hear from the medical community, his perspective about what kind of our new world looks like. And so I guess this conversation is not over. This will be there's an ellipsis at the end of this particular town hall that we're having because this is a continually evolving situation.
Yeah, definitely. I mean, I think we've learned a lot from the start of this pandemic. I think we've made some great progress. We still have a ways to go, but I love how Utah responds to things and how people come together and we create great solutions. And we're going to get used to this new normal. We're going to get used to these things, just like Dr. Good suggested, after 9/11. We got used to all of that at the airport. We're used to it now. We're going to get used to these symptom checks and things and wearing masks, and we're going to be better for it. So,
Well, thanks to Senator Cullimore, who came and joined us here. Thank you to Altera Medical and Touring Video. You can find out more about them, obviously, on their websites. We thank you for Mayor Troy Walker being here. Thank you, Greg, for your leadership at South Valley Chamber. And also want to thank Robert Half. Robert Half sponsors our Silicon Slopes Sandy Draper chapter events. And normally they buy big breakfasts and big lunch. But today they're paying for videographers. So we thank you to Robert Half and all you do for recruiting and helping the talent pipeline here in Utah, which is critical to our economy.
I would just say too, for questions on Utah's plan, go to coronavirus.utah.gov. There's a wealth of information on there, and as we do move into this orange phase, this moderate phase, there's a lot of helpful information for individuals and businesses of the requirements or the suggested recommendations that people should be following. So, like Dr. Good said, stay healthy, stay safe out there.
Yes, thank you.